I'm speaking with Dr. Pamela Tume, an affiliate at Empirical Assessment Solutions. It seems that every week the focus for businesses and associations is on dealing with a different element of the pandemic. And for many, recently, the focus has shifted towards developing a return to work strategy. Pamela, welcome. You have particular insights into this issue. What can you tell us about the key areas that businesses need to address in developing their planning process?
So I think really it can be classified, so it's a gradual return to work in the models that most people are going to be working to. Some essential workers will already be in their office and been in an environment where they've had to accommodate to things like social distancing and potentially mitigative measures like wearing masks as an example. But by and large, most companies are looking for, I'll call it the governance model that will allow them to look broadly at all of the risks that are associated with their business and find tangible ways to help people to be productive. I think many people have been actually pleasantly surprised in our in knowledge worker areas with the high adoption rate to using working from home technologies. So if I was to put it broadly into three areas, I think you need to look at the preventative and mitigative measures you need to have in place in terms of ensuring that worker safety and worker health are always kept top of mind. There is also a model of looking at access controls. So access controls in this world that we're referring to aren't just physical access controls. They can also be virtual access controls that will need to be maintained over time. And thirdly, there's the physical layout and the accountabilities that need to be put in place so that people know who's making the decisions and what those decisions look like. So for instance, if you're in a cubicle environment, which most knowledge workers are especially in urban settings, now your cubicles are going to have to be positioned so that you can safely maintain 6 feet or 2 meters of physical separation at all times. So how do you do that when you're having a challenge meeting and you're looking at a very topical item that, you know, people become very passionate, knowledge workers in particular, about their ideas and concepts, and you have to create an environment where they can have those challenging conversations, but it doesn't necessarily mean you do it with a mask on, because that could, you know, pull people back and make them uncomfortable with bringing things forward because they can't speak freely, right? So there's those well-being pieces that go with the dynamics we're talking about when you return to work.
Very interesting. Can you give some examples of ideas that have been floated around to facilitate such interactions?
Simple things like figuring out the maximum occupancy of a conference room. So typically when you go in a conference room, you'll have your whiteboard and your computer and a desk or a table, like if it's a boardroom style. And you'll have, you know, people will have normal seating. And usually the perimeter of that table has maximum seated capacity. Well, now you're in a place where you can't put people shoulder to shoulder anymore, right? You have to make sure that there's 6 feet or 2 meters separation between each of those individuals. You then have to say, well, okay, so if I do that, what's the optimal seating arrangement in that conference room? Do I have a maximum occupancy load now for people to maintain social distancing in the way you have maximum occupancy for a fire code, right? So now all of a sudden you have to think about not only the rooms you have, but how are you going to use those rooms? Is it more practical to have people not go to a conference room? Is it more practical to facilitate it on a platform like GoToMeeting or through some other form of Microsoft product like Teams, right? Is that the better way of doing it? But then you also have to figure out how to lead those meetings. Leading a teleconference meeting is very different from being able to see all the nonverbal cues, because half of our communication is nonverbal. How do you do that in a practical way so that the smallest of voices have a space so that they can present their ideas and concepts?
I think that a future video in this series might just address how to facilitate these meetings in an effective way. I'd like to touch on preventative and mitigative measures. Can you expand on these?
So one of the World Health Organization and our governments are strongly advocating for contact tracing, which is, the process of identifying someone who could be the source of an infection, and then how does that chain of interaction happen. Businesses aren't relieved of that requirement either. There is a model where you have to consider that what if you have an employee who all of a sudden, they come in at 9 o'clock in the morning and then they identify partway through the day that they're not well. You can try and safely extract them from where they are, but if they're really in a position where they're not physically able to leave the office, what's your contingency plan to move them safely out? How do you get them home? Because the duty of care isn't relieved because the guy's going back to his home. The duty of care extends from the moment that employee's on your premises and they're in gainfully doing work for you. So then you also have to think of, well, do I need to enhance my normal emergency measures for how do I remove that employee from the office? And then who did they talk to that day? How do I know who they talked to if they're not feeling well? Will they even remember? Do I have to have zones of control where I have, okay, so they were occupying this floor for the period of the day. They went up one hallway. They were able to interact in the kitchen. How many other people were in that situation? And all of them need to be apprised that this employee is now ill. And then you turn to, well, okay, so we let those employees know. So they monitor themselves for 14 days and come to work? Or do they work virtually?
These are very critical issues. Pointing them out the way that you have highlights the fact that it can impact businesses tremendously. If someone falls ill in the business, it might actually require all the employees to move back into isolation at a moment's notice.
Yeah, and the other part of this as well is if that person's a singleton expert, and many companies have them, now you have a different vulnerability in the quality food chain of the business.
Yes.
And how do you address that, right? Other areas, for instance, if I mentioned cubicle world. Well, in cubicle world, cubicles are co-joined. They share common walls. And typically those common walls have seats that are less than 6 feet apart.
Can you speak about access control as well?
Access control is an interesting area because it's not just about, do I have someone that has a legitimate need to be present in the business? But how do I practice my duty of care for the well-being of my employees to ensure that I only put a certain load in the physical building? Contact tracing and all that kind of stuff would be a factor in the background. So do I have to have a process for people to have the right level of oversight? How is management ensuring that only people who really need to be in the office are in the office, as opposed to people self-selecting to come to the office? And when you self-select to come to the office, how do I ensure that the work you're doing is productive, knowing that maybe half of your team isn't there? Is it something where, management lording over employees doesn't work either? You turn people off and then they don't want to do their job, right? How do you effectively supervise? So access control is one of those things where you have to make sure there's a legitimate need, a justification to be in the business, that people are only working in the area they're supposed to. If there are changing conditions in the day, what is your measure to ensure that people are properly balanced? Do you decide to divide your staff into 2 teams or different shifts, right? How do those shifts interact with each other? Are they all on a common project? Or if they're not on a common project, are you ensuring that certain disciplines are present at all times in the organization to ensure work gets done?
All very interesting issues that you've raised here, Pamela. It's going to be very interesting to see how these return to work policies play out in the coming weeks and months ahead. Dr. Pamela Tume, I thank you very much for your time, for your input. I look forward to further discussions on this and related issues. Thank you very much.
My pleasure, Ron. Thank you.